Fibroids are actually benign growths that occur in the female uterus. It's estimated that 1 out of 3 women over 35 has fibroids, and that 1 out of 2 Black women, especially of Caribbean descent, actually have fibroids. These symptoms can be extremely debilitating. Commonly, they are heavy bleeding, including passage of blood clots, which can result in anemia. There are a number of women I've taken care of over the years who have been so anemic that they've required emergency blood transfusions. A UFE stands for uterine fibroid embolization, and basically this procedure is a minimally invasive procedure that we offer women who have symptomatic fibroids and/or adenomyosis. The procedure can safely be performed in an outpatient center. The procedure typically takes 1 hour from start to finish, with several hour recovery time afterwards. The goal of the UFE is threefold. Number one, these fibroid tumors are very vascular, so by cutting off the blood flow, we are eliminating women with their heavy bleeding, passage of blood clots, heavy menstrual cycle. Number two, by cutting off the blood flow, the fibroids that they have are going to shrink and are going to scar and retract into the wall of the uterus, and no new fibroids should grow. Third component, especially for some of these women with the bulk symptoms that we had mentioned, the fibroid scar tissue that remains is much softer, and the fact that it's softer, smaller, and devascularized, that combination gives women the relief that they're looking for. One of the many benefits of a UFE over traditional surgery such as a myomectomy or a hysterectomy is it is a much shorter recovery time for these patients. Number one, it's a twilight sedation, so it's not recovering from the effects of general anesthesia. Number two, since there's no surgical incision, that there's no wound healing, it's a Band-Aid that they're able to remove the next day. Oftentimes with the surgical procedures, their recovery time can be 6 to 8 weeks. Typically with our procedures, we ask patients to take 2 weeks off from work, but that being said, I've had patients return to work in 3 days. I've had patients that have required a little more than 2 weeks, but the average time for recovery is about 7 or 8 days. And what that recovery time entails is they're somewhat crampy and bloated afterwards, but each day they progressively feel better than the day before. The effectiveness or the success rate of this typically is over 98%.